the sacrum. That's a very common spot for pressure injuries to form for patients that are mostly in their beds. So that patch that you asked about that's on the bottom, it's called Mepilex. It's just an extra prevention measure that we use on patients like him to prevent breakdown. It provides just an extra layer of soft.
All right.
Yeah, you can. I'll find one to send with you guys. It just sticks on the back for prevention injury, and it can stay on as long as it's clean.
Okay.
And just make sure that every once in a while you're peeling it back. Make sure there's nothing crazy. What you can do to test
and it will stick again.
Yeah, it'll stick again. It's very sticky. Sometimes too sticky. You can take 2 fingers and you can press on the sacrum. If there might be a little redness now, that's pretty normal because he's in the bed. If you press on it and it turns white and goes back to red, that means it's blanchable.
Okay.
If you press on it and it stays red, that can be worrisome in terms of something could be starting to form, even if it looks totally normal. So that's why the turning schedule is so important.
Can you show me where is the sacrum?
The sacrum, okay, so it's the tailbone, like right here. It's a big patch. It covers like a big part of his bottom. So I have like here. This is gonna be. So here's his back side, okay. So he's got the butt. There's his bottom.
Yeah.
So the sacrum patch is gonna kind of sit like this.
Okay. The patch
it's like at the top of the butt crack. And a little bit up further. It's like right where the tailbone is, sacrum coccyx area. So that's where we put it, and that it's specific to that. Stuff can also form on his spine. It's not necessarily as common, but again, that's why we do the turning schedule. These wedge pillows will be sent with you. These boots here are very good because what they do is they alleviate the pressure of his heels. All right. That is another huge spot where pressure injuries form. I find them all the time because I always am looking.
And Kathy, you'll have to show us that later because we can't see any of it. You'll have to show us what she was showing you because we can't see any of that.
Oh, look, it's just a dry.
Mm-hmm. Okay, here's his backside. It's right here. It's called a Mepilex. It is there for pressure injury prevention, and it just sits like right at the top of the butt crack and a little bit further up.
Okay.
It's a very it's a pressure point that everybody has when they're laying down or even sitting in a chair. So these green wedge pillows help prevent that. They're under him right now. There's also these boots over here. Some patients like them, some patients don't. Oh, I'm so sorry. Some patients like them, some patients don't. What it does is it relieves pressure on his heels. If he ever wants a break from them, you can put just a pillow under his heels, under his
calves.
Calf. Thank you. I should know this. Right under his calf, like we have right now, because he wanted a break from them. Can you see that?
Yeah. Mm-hmm.
So his heels, there's space between. Like I can fit my whole hand underneath. Yeah. So there's nothing touching. Okay. So just monitor them. Make sure. Yeah, you guys get to keep all of this.
All right.
And I'm even gonna get some extra too. As well as sending all of that thickened liquid with you. I've added some extras.
Okay.
Everything that's there we will send with you.
All right.
Let me think. So in terms of fully cleaning, that's not something that necessarily needs to be demonstrated. What you do is just soap and water.
Okay.
You clean it wet. Let's say he has a little bit of a bowel movement from his rectum, and maybe it gets in that area, and you just want to make sure soap and water.
Okay.
Soap and water with a towel, and then make sure you dry it when you're done.
Okay.
It's very simple. You can do it several times a day, at least twice, maybe once in the morning, once in the afternoon. We do it three times a day. So usually at the end of each shift, but whatever is best for you guys and your family, just make sure it stays clean to prevent infection.
Dad's waking up here. Oh, what are you on? Mm-hmm. Right. Can you explain to me one more time how to check if you press the skin in?
So trying to see if there's a spot on my hand. So my hand is a little red here because I hit it today. If I press on it, it turns white and goes back to red. That's good. If I press on it and it stays red, it means, okay, we might need to offload his sacrum a little bit more. Gotcha. And you can adapt his turning schedule to what's best for him. It doesn't have to be strictly exactly at 2 hours. That's just how we recommend it and try to follow. Like here, with all the craziness going on, sometimes it's 2 hours and 10 minutes that he's on his left side. Mm-hmm. And if you're worried about his back and his sacrum, you can just go back from right to left.
Okay.
And maybe have half a day, nothing on the back. No pressure on the back, if you need to. Sometimes I adjust it based on the patient, based on what I know they like. Like if a patient has broken ribs, we don't turn them on that side, stuff like that.
Okay.
So it does adapt to the patient, but we just recommend this turning schedule.
Okay.
And I'll make you guys
Thank you.
a copy.
All right.
And you'll get take all of this with you too.
Okay. What other pressure spots would we
Okay,
need to
common
be
pressure
concerned
spots.
about?
Heels. Sacrum. Also, actually, on both sides of the hips. Now, not all patients are super bony. I'm super bony here, so if I was laying on my side for a long time, I'd probably develop something.
Okay.
He's not super bony, but that's why we do the turning schedule. Some patients will just lay on their side at home all the time. That can cause one, so it's like right here.
Okay.
Okay, another one is elbows. Not super common. I've actually never seen an elbow pressure injury, and I've been here for years.
All right.
So it's just something like keep his arms in different positions, put pillows under them, have him move his arms. It's kind of like with the range of motion stuff. Elbows can't happen all the way up the spine. Can happen too.
Okay.
We don't see those quite as common. It's usually the sacrum, which are the most common ones, just because that's the spot with the most weight.
Right.
Occasionally, it can be up here on the scapula, here, here. But like again, with turning
sorry.
spots,
Do that again.
like on my back here, those can sometimes be depending on where their arms are positioned. But again, if you're
Side shoulder or?
no back here,
Okay.
like
Yeah, right.
Shoulder blade.
now for him, he's not super bony, so again, that's why we have the turning pillows and we're moving his arms in different positions.
I think the only one that has been an issue in the past, as far as becoming a problem, has been the sacrum.
That is the one that's the
And
most
that was-
common. I don't know if I can give you a percentage, but that is where I find everything. Usually is the sacrum and the heels, because heels isn't something we typically think about.
And so it's not actually a wound. It's
No,
a,
not
it's a
necessarily.
bruise.
Like this is looking very nice. It's healing up nicely. I'll give it one more bandage before he leaves. It can stay open to air
Okay.
because that will heal it as well. We just like to put those on while they're in the hospital because it also prevents from getting whatever in it, really anything in it.
Okay.
So I can change that one time before he goes.
Okay.
Okay.
Mm-hmm.
Okay. This port here, you
Okay.
do not need to worry about that. That is actually strictly for hospital use. If we need to do a urine sample, that's where we collect it.
Oh,
So
all right.
that won't open. It shouldn't leak.
Okay.
It shouldn't have a problem. This flip here is just like you could put it on a sheet. It's an extra prevention thing. Here, bring a little forward. It's attached to the Foley. It's a sheet clip. You just flip it on a sheet. It's just an extra level of protection to make sure it doesn't get pulled out. For him, we haven't used it because we don't need it, but it's there if you need it.
Okay.
Nice.
Yeah, they've thought these things through.
Okay.
I did not come up with that.
Are they work? So I think we're comfortable with the Foley part of it.
Yeah.
The IV part.
IV.
that's a-
So IV
Foley.
is not. This will be out. That will not stay with him.
This part.
Yes, this in his arm. That is for hospital use only. We do not send patients home with that kind of IV.
Okay.
If a patient went home with an IV, it would be like a midline or a PICC line, and there would be special instructions.
They are doing that, right?
No, actually. Right now, when I talked to the doctor earlier, he came in and spoke to the patient. He's going to come in and talk to you about the IV specifically.
He's not coming home with an IV?
No, that's what I was told this morning, but the doctor's going to come and talk to you about that as to reasons why.
I thought they cleared it with the psychologist.
Did you talk to him about that this morning?
No, the last time we heard from him yesterday, they talked
So
about children.
I wasn't here yesterday for that conversation, so he said he was going to come in and talk to you about that. I'm going to page him to come talk to you guys about that. Dr. Yu, yes.
My anxiety level went.
Okay, but he's going to answer all of your questions, and if it does come to like, if after talking with you, we can get it placed. I'm not saying it's not happening for sure, but he told me this morning that we're holding off on the IV placement for right now. He will explain all of it to you. Okay. I'm gonna page him so that he comes because I want to make sure he comes and sees you. Okay. I'll be right back.